Hi, my name is Gretchen Goldman. I'm the research director at the Center for Science and Democracy at the Union of Concerned Scientists. And today I'm going to be talking about some work I've been doing around federal science policy and local impacts on marginalized communities. Let me go ahead and share my screen. My co-authors are Michelle Roberts of the Environmental Justice Health Alliance and Anita Desikin and Casey Kallman, who are at the Union of Concerned Scientists as well. So there's longstanding inequities in air pollution exposure and the ability of our laws to protect people. This is true in large part because the Federal Clean Air Act in the United States is insufficient to protect environmental justice communities. And this is true in terms of the law coverage, what is actually in the law itself and what has been written there and how it's been written. It's true on the implementation and enforcement side as well. There's gaps in how it's being interpreted as well as enforced. And this is true when you look at different parts of the Clean Air Act, from the ambient standards, which include things like particulate matter and ozone. Also, when you look at hazardous air pollutants, these are many cancer-causing components, such as benzene. And also around different segments like permitting, which happens at the local and state level. And one major gap in the Clean Air Act is its failure to think about and regulate cumulative impacts. Cumulative impacts being protecting communities from multiple sources of air pollution. And so if you are a community like Harrisburg, Manchester here in Houston, you are potentially impacted by many sources. And our legal framework in the United States doesn't have a great way of handling that and thinking about getting exposure from different contaminants, because many of the regulations are on single sources or only thinking about places far from the fence line of communities and only monitoring further from where communities are breathing. And we see the outcomes of these regulatory gaps. Many studies now have shown the very disproportionate burden that communities of color face when it comes to air pollution. This was a recent study looking at particulate matter 2.5. This is fine particulate matter that is associated with premature death and other health effects. And you see in many of the states across the country, communities of color bear a greater burden of particulate matter pollution than white counterparts. And many of the recent federal air pollution policy actions that we've seen in the past few years have worsened these inequities. So I'm going to go through a few of those changes and then zoom in on some particular examples. So this is true on many of those ambient air pollution standards I referred to. The ozone and particulate matter processes have been affected and may be worsening of inequities that existed already. There's also been changes to cost-benefit analysis, and these are ways that the U.S. Environmental Protection Agency measures what the costs and benefits of a rule are. They've also proposed recently a rule at the federal level that would undermine the ability of the EPA to even use science and use all relevant science in regulatory efforts. And there's a whole bunch of actions that have been taken at the federal level that I'm calling loosening of emission standards. And a lot of these are tweaks to guidance and changes in interpretation, many things that don't necessarily even make large headlines, but will nevertheless have the impact of lessening regulation, weakening protections for the public on air pollution. And there's also a lot of happening in terms of long-term consequences at the EPA and other changes across the government. These are things like the reduced capacity and expertise because of people leaving the Environmental Protection Agency, and these stand to affect the agency's ability to protect marginalized communities in the long run. So I'm going to zoom in on a few examples of what these changes mean for environmental justice communities. I'm going to focus on the particulate matter NAAQS, the National Ambient Air Quality Standards for particulate matter, as well as a change in the guidance on hazardous air pollution maximum achievable control technology. So for particulate matter, one of the first things the administration did on this, the Trump administration did, was nix a key panel that was set to inform the standards. This removed a lot of experts that would have informed the particulate matter standards. And this really mattered in terms of the agency's ability to get a science-informed process in place. And that's because the rule is primarily informed by CASAC, this Clean Air Scientific Advisory Committee, but they are only 7 people. And so historically, they've always been supplemented by these pollutant review panels, like this particulate matter review panel. And together, that gets a lot of scientific expertise into EPA's policy process to determine air pollution standards. Those committees would look at all of the science and policy documents, conduct a public peer review of science and policy on a given pollutant, and that would feed into recommendations to the EPA administrator on what the science-based standards are and what would protect public health. But the Trump administration nixed that particulate matter review panel, removing a lot of the scientific expertise that should have informed the standard. So that means a lot less science went into the particulate matter standards than they would have, and that has consequences for the standards' ability to protect communities, especially marginalized communities. And this is a problem because under the Clean Air Act, the National Ambient Air Quality Standards are supposed to protect public health with an adequate margin of safety. And that includes the increased risk to certain groups from effects. And so what you really need is scientists to look at the state of the science, particularly for at-risk groups, to determine if the standards are adequate to protect public health. And that's a lot harder to do when you don't have the experts to look at, what those health impacts are, who's affected. This is really the cutting edge of science, and we were deprived of that scientific expertise. But that panel that was dismissed chose to meet anyway, and the 20 scientists met and discussed the state of the science and policy on particulate matter and informed the administrator. And what they found was that the current standards are not adequate to protect public health, and they should be tightened if we want to protect people. And with respect to this talk, I wanted to call out one thing that the panel said in their talk, which is that they recommended more explicit discussion of environmental justice, including more depth regarding disparities in PM 2.5 risk borne disproportionately within the African American and Hispanic populations. So this was I wanted to call this out because the panel recommended that the EPA do more of this work, think about it, insert into the standard development discussion of environmental justice issues, which would feed into the administrator's decision. But because the Trump administration dismissed this panel, the EPA never did take this advice, and there was no further discussion of environmental justice. So that means because of the panel's dismissal, we all were deprived of that additional discussion of environmental justice. And in the end, that mattered because the administrator didn't have that information in front of him when he's making the decision about the particulate matter standards. So in the end, that panel said that the current standards are not protective. That remaining 7-person committee was split. They couldn't come to conclusion on whether it was protective or not. And EPA scientists thought the standards were not protective. And in the end, so far, it looks like the EPA administrator is going to finalize a rule that will not tighten the standards. He only used that split committee as his scientific backing, and there was no reference to at-risk groups or environmental justice in that decision, unsurprisingly, because we didn't have that information. We didn't have that in-depth discussion that we would have needed. And another one I wanted to talk about is repeal of the once in, always in rule for hazardous air pollutants. These are cancer-causing pollutants that come directly from industrial sources, and the EPA lifted something that had been a protection in place for decades on this rule. We conducted an analysis and looked at what the potential impact of this loosening of emission standards could look like, and we found there could be big swings in many places, many communities that would could potentially get a lot more hazardous air pollution if emission standards were loosened following this rule. At least 21 states could see more hazardous air pollution under this new guidance. And in Louisiana, in the part known as Cancer Alley, we see 42 facilities in this one area could see emission increases because of this policy change. And so this is all compounded with what happens at the state and local level. We see a lot of challenges there with how air pollution is protection. There's a patchwork of laws across states that vary widely. There's inadequate enforcement and monitoring capability at the state and local level, where there's significantly less resources than at the federal level. There's often limited opportunities for meaningful community engagement in the permitting process. States have some leeway here, and it's not always given adequate space for affected communities to weigh in. There's limited consideration for cumulative impacts from multiple sources and those impacts on individual communities if you're in a place with many air pollution sources at once. And there's potential for bad corporate actors, intentional wrongdoing, hiding of misinformation as well. But there's been some efforts at the federal level to really advance these issues. One is this bill I wanted to call out from Representative Lisa Blunt Rochester of Delaware. She has proposed a bill that would require more emissions monitoring, particularly on NACs and hazardous air pollutants. This would require the EPA to employ fence line monitoring, so monitoring at the fence line of industrial facilities, which is currently not widely used. It would ensure that those fence line monitors and continuous monitors are components of national emission standards. This is a crucial component because we need to make sure that that science and what we're measuring carries into policy decisions. So this is a huge opportunity and would do a lot to ensure that we have health protective standards for all communities. It also expands the existing national ambient air quality standards monitors. This would expand our ability to measure things like particulate matter and ozone, which we know have disproportionate impacts on communities. And it would deploy new air sensors within communities. So this would be important because it really expands coverage. Currently, often monitors are not placed at fence lines or within communities. They're only placed at specific areas that are often intentionally far from facilities. So placing them in the places that communities would like to see them and places that we know are directly impacted by industrial facilities would be a huge gain. And there's also a lot more that we can do at the federal level. This is a fact sheet that the Union of Concerned Scientists has put out, and this is thinking more about what the federal government's role is in environmental justice, and then what they can do at the EPA and across agencies as well. Some ideas from that are some mandatory policy changes and making sure that equity is a consideration and centered in a lot of decisions that affect communities. Ensure that communities are able to know about environmental hazards and what their options are around individual facilities. Also eliminating a lot of those barriers that prevent marginalized communities from engaging meaningfully, making sure that hearings and opportunities for input are accessible and available in a variety of ways. And also ensuring that there is that connection between the science and the policy decisions, ensuring that the scientific questions that asked are focused on communities and what they need and what they want, and ensuring data is publicly available. So I'm going to end there, and thank you so much for your time. My co-author, Michelle Roberts, will be speaking with you in the panel discussion, and I look forward to a robust discussion. Thank you.